A major review study released in the June 2012 issue of the Heart Journal concluded that taking calcium supplements alone or not in the proper balance could actually double your risk of having a heart attack. The main concern is the fact that when calcium is taken alone or not balanced with other important nutrients, that calcium is actually deposited in your arteries instead of your bones where it is needed. This leads to an increased risk of having a heart attack. This has certainly created a significant concern among the medical community because physicians have been strongly recommending calcium supplementation to their patients for several decades. Now it is important to remember that calcium is critical in nearly 180 different chemical reactions within the body. It has been determined that nearly 80% of the adults and approximately 40% of our children are deficient in calcium in the U.S. and China. Calcium is not only critical for healthy bones, but also for normal nerve conduction and for the normal rhythm of your heart. It is also very important for contraction and relaxation of your muscles and arteries. Therefore, supplementing calcium is still very important for your health, but how can you supplement calcium safely? First of all, clinical studies are showing us that you should never supplement calcium alone. Also, you should always be supplementing calcium along with magnesium. 80% of both adults and children in the U.S. and China are deficient in magnesium. Having proper levels of magnesium in our bodies is critical for bone health, heart function, muscle function, and general health. Clinical studies are now showing that magnesium needs to be balanced with calcium supplementation in a 1-to-1 ratio. In other words, you need to be taking highly absorbable calcium and highly absorbable magnesium in the same amount in your supplements. Second of all, you need to realize that you're not able to absorb any calcium, no matter how much you are supplementing, if your vitamin D levels are low. Vitamin D is necessary for absorption of calcium within the GI tract. The most active form of vitamin D is vitamin D3. Nearly 90% of the population is deficient in vitamin D. Having proper vitamin D levels is critical for our health. Those individuals who have the highest levels of vitamin D decrease their risk of almost all cancers by 80%. They decrease their risk of developing diabetes by 50%. As well as decreasing their risk of developing diseases like MS, heart failure, or having a stroke. In order to ensure you have adequate levels of vitamin D, we recommend supplementing your diet with somewhere between 2,000 and 4,000 international units of vitamin D3 daily. However, the most critical nutrient needed to assure that your calcium supplement is deposited in your bones and not in your arteries is vitamin K2. Vitamin K2 acts like a traffic cop that allows calcium to deposit in your bones, and it also blocks calcium from being deposited in your arteries. Now, this property is unique only to vitamin K2. Vitamin K1 does not have this ability and is not able to accomplish this critical task. Therefore, you want to be sure that your calcium and magnesium supplement contains vitamin K2 and not vitamin K1. Finally, it is critical that your calcium and magnesium supplementation contains the highest absorbable calcium and magnesium. Research has shown that the most absorbable calcium is calcium citrate and calcium malate. Calcium carbonate is the cheapest and the poorest absorbed because it is dependent on the acid content of your stomach. Since acid production decreases as we age, calcium carbonate gets harder and harder to absorb when we need it the most. In fact, studies show that we are only able to absorb about 50% of calcium carbonate. In contrast, calcium citrate and calcium malate are not dependent on stomach acid for their absorption. Magnesium amino acid chelate, magnesium taurate, and magnesium glycinate are the highest absorbable magnesium in the marketplace today. It is sad to see that most magnesium supplements contain magnesium oxide, which clinical studies show is only about 4% being absorbed. So if you are trying to achieve a balance of calcium and magnesium in your supplements, you not only need to be looking at the amounts you're getting, but are they being absorbed? You want to be consuming a calcium magnesium product that has been developed based on this cutting-edge medical research so that you receive the positive health results and avoid the potential negative consequences of taking calcium supplements.